If you're like most seniors, you probably take at least one prescription medication every day, maybe even several. You trust that these pills are helping you manage your health, control your symptoms, and keep you feeling your best. But what if I told you that some of the most common medication habits could actually be putting you at risk? What if, without even realizing it, you're making mistakes that could lead to dangerous side effects, drug interactions, or even life-threatening emergencies? Today, I'm going to reveal the 6 most dangerous mistakes people make with their medications. Mistakes that doctors and pharmacists see every day, but that rarely get talked about in detail. If you want to protect your health, avoid unnecessary hospital visits, and make sure your medications are working for you, not against you, this is a video you can't afford to miss. Let's start with a simple truth. Medications can be life-saving, but only when they're used correctly. As we age, our bodies change in ways that affect how we absorb, process, and respond to drugs. Our kidneys and liver may not work as efficiently as they once did. We may be more sensitive to side effects, or more likely to experience dangerous interactions. And with every new prescription, the risk of mistakes goes up. That's why it's so important to be proactive, informed, and careful with every pill you take. So, what are the 6 most dangerous medication mistakes, and how can you avoid them? Let's dive in, starting with one of the most common and most overlooked errors. Mistake 1. Mixing medications without checking for interactions. It's not unusual for seniors to be prescribed multiple medications by different doctors, one for blood pressure, another for cholesterol, maybe something for pain or sleep. But did you know that some drugs can interact in ways that make them less effective or even dangerous? For example, certain blood thinners can interact with common pain relievers, increasing your risk of bleeding. Some heart medications can interact with antibiotics, leading to dangerous changes in heart rhythm. Even over-the-counter drugs and supplements, like antacids, herbal remedies, or vitamins, can interfere with your prescriptions. The solution? Always keep an up-to-date list of every medication, supplement, and vitamin you take, and share it with every healthcare provider you see. Don't assume your doctor or pharmacist knows everything you're taking. Be proactive and ask about potential interactions every time you get a new prescription. And never start, stop, or change a medication without checking with your healthcare team first. Mistake 2. Not taking medications exactly as prescribed. It might seem harmless to skip a dose, take a little more if you're in pain, or stop a medication early if you feel better. But these small changes can have big consequences. Skipping doses of blood pressure or diabetes medications can lead to dangerous spikes or drops in your numbers. Taking too much of a painkiller or sedative can cause confusion, falls, or even overdose. Stopping an antibiotic early can allow an infection to come back stronger and harder to treat. The fix? Take your medications exactly as prescribed at the same time every day. Use a pill organizer, set alarms, or ask a family member to help you remember. If you have trouble swallowing pills, or if you're experiencing side effects, talk to your doctor. Don't just stop on your own. There may be alternatives or adjustments that can help. Mistake 3. Ignoring changes in how you feel. Sometimes, the signs of a medication problem are subtle. A little more tired than usual, a new ache or pain, a change in appetite or mood. Other times, the symptoms are more obvious: dizziness, confusion, trouble breathing, or a rash. It's easy to brush these off as just getting older, but they could be signs of a serious reaction or side effect. The key is to pay attention to your body and speak up if something doesn't feel right. Keep a journal of any new symptoms and bring it to your doctor or pharmacist. Don't be afraid to ask questions or push for answers. You know your body better than anyone, and your concerns deserve to be taken seriously. Mistake 4. Storing medications incorrectly. Did you know that where and how you store your medications can affect how well they work? Some drugs need to be kept in the refrigerator, while others should be stored at room temperature, away from heat and moisture. Leaving pills in a hot car, a steamy bathroom, or direct sunlight can cause them to break down or lose potency, and mixing different pills in the same bottle can lead to confusion or accidental double dosing. To avoid this mistake, always read the storage instructions on your medication labels. Keep your pills in their original containers with the labels intact. Store them in a cool, dry place, ideally in a locked cabinet, out of reach of children or pets. And never use medication that looks discolored, smells strange, or is past its expiration date. Mistake 5. Not reviewing medications regularly. As your health changes, your medication needs may change too. But many people stay on the same prescriptions for years, even when they're no longer needed, or when safer alternatives become available. This can lead to unnecessary side effects, drug interactions, or even dangerous overdoses. Make it a habit to review all your medications with your doctor or pharmacist at least once a year, or whenever you have a major health change. Ask if every drug is still necessary, if the dose is still right, and if there are any new risks or alternatives you should know about. Don't be afraid to ask questions or seek a second opinion if something doesn't feel right. Mistake 6. Not understanding what your medications are for. It's easy to lose track of why you're taking each pill, especially if you have a long list of prescriptions. But not knowing what each medication does or what side effects to watch for can put you at risk. You might miss early warning signs of a problem, or take the wrong drug at the wrong time. The solution is simple. Ask your doctor or pharmacist to explain every medication in plain language. Write down the purpose, the dose, the timing, and any special instructions. Keep this information handy and review it regularly. The more you understand, the safer you'll be. Now that you know the 6 most dangerous mistakes people make with their medications, let's take a closer look at why these errors happen so often and what you can do to protect yourself and your loved ones. Because the truth is, even the most careful, well-intentioned people can fall into these traps, especially as the number of prescriptions and health conditions increases with age. But with a little knowledge, some practical strategies, and the confidence to ask questions, you can take control of your medication routine and avoid the pitfalls that put so many seniors at risk. Let's start with the reality of polypharmacy, a term that simply means taking multiple medications at the same time. For many seniors, it's not unusual to have 5, 10, or even more prescriptions, plus over-the-counter drugs and supplements. Each new medication adds another layer of complexity, and the risk of dangerous interactions or side effects grows with every pill. It's easy to feel overwhelmed, but you don't have to navigate this alone. Your pharmacist is a powerful ally. Pharmacists are trained to spot potential drug interactions, duplications, and dosing errors. Make it a habit to use the same pharmacy for all your prescriptions, so your pharmacist has a complete record of what you're taking. Don't hesitate to ask for a medication review or brown bag check. Just bring in all your medications and let the pharmacist look them over for safety. Another reason medication mistakes happen is communication gaps between healthcare providers. You might see a primary care doctor, a cardiologist, a rheumatologist, and maybe even a few specialists for your eyes, ears, or bones. Each provider may prescribe something new, but they don't always have the full picture of what others have recommended. That's why it's so important to keep an up-to-date medication list and bring it to every appointment. Include the name of each drug, the dose, how often you take it, and why you're taking it. If you're not sure, ask. This list can be a lifesaver in an emergency, and it helps every provider make safer decisions for your care. Let's talk about adherence, the medical term for taking your medications exactly as prescribed. Studies show that up to half of all seniors don't take their medications as directed, often because of forgetfulness, side effects, cost, or confusion about instructions. If you struggle to remember your pills, Try using a pill organizer with compartments for each day and time. Set alarms on your phone or watch, or ask a family member to help you stay on track. If side effects are a problem, don't just stop taking the medication. Call your doctor and ask about alternatives or adjustments. If cost is an issue, ask about generic options, patient assistance programs, or other resources that can help. One of the most dangerous mistakes is sharing medications with friends or family. Maybe you run out of your prescription and borrow a pill from someone else, or someone offers you a leftover medication for pain or sleep. This is never safe. Even if the drug looks the same, the dose, strength, and instructions may be different. You could have an allergic reaction, a dangerous interaction, or take the wrong dose for your condition. Always use your own prescriptions and never share or accept medications from others. Let's not forget about over-the-counter drugs and supplements. Just because something is sold without a prescription doesn't mean it's harmless. Many common pain relievers, cold medicines, antacids, and herbal supplements can interact with prescription drugs or cause side effects on their own. For example, NSAIDs, like ibuprofen, can increase the risk of bleeding if you're on blood thinners, and some herbal remedies can interfere with heart or blood pressure medications. Always check with your pharmacist or doctor before adding anything new to your routine, and keep a list of all non-prescription products you use. Another area where mistakes happen is medication storage and disposal. We talked about keeping drugs in the right environment, but it's also important to get rid of old or unused medications safely. Don't flush them down the toilet or throw them in the trash, where they can harm the environment or be found by children or pets. Many pharmacies offer medication take-back programs, or your local police station may have a drop-off box. If you're not sure how to dispose of a medication, ask your pharmacist for guidance. Let's address the issue of changing health status. As you age, your body's ability to process medications can change, especially if you develop new health conditions like kidney or liver problems. What worked for you 5 years ago may not be safe or effective today. That's why regular medication reviews are so important. If you notice new symptoms, like confusion, dizziness, swelling, or changes in appetite, don't assume it's just aging. It could be a sign that your medication needs to be adjusted. Finally, let's talk about empowerment. The most important thing you can do to avoid dangerous medication mistakes is to be an active participant in your own care. Don't be afraid to ask questions, double-check instructions, or speak up if something doesn't feel right. Your healthcare team is there to help you, but you are the expert on your own body. Trust your instincts, and never hesitate to seek a second opinion if you're unsure. To sum up, avoiding dangerous medication mistakes isn't about being perfect. It's about being informed, organized, and proactive. Use one pharmacy. Keep an updated medication list. Take your pills as prescribed. Never share medications. Check with your pharmacist about new drugs or supplements. Store and dispose of medications safely. And review your regimen regularly with your healthcare team. These steps can help you stay safe, healthy, and in control of your medications, so you can focus on living your best life. In the next section, we'll explore real-life stories, practical tips for organizing your medications, and how to talk to your doctor or pharmacist about your concerns. Because when it comes to your health, knowledge truly is power. Let's bring these lessons to life with some real-world examples and practical strategies you can use right away. Because while knowing the 6 dangerous medication mistakes is important, it's the small, daily actions that truly keep you safe and healthy. Consider the story of Helen, a 74-year-old who was taking medications for high blood pressure, arthritis, and cholesterol. She started feeling dizzy and weak, but assumed it was just part of getting older. One day, she nearly fainted while gardening. Her daughter insisted she see her doctor, who discovered that Helen's blood pressure medication was interacting with an over-the-counter cold remedy she'd started taking. The fix was simple. Her doctor adjusted her prescriptions, and her pharmacist helped her choose a safer cold medicine. Helen's dizziness disappeared, and she learned the importance of always checking with her healthcare team before adding anything new, even something as common as a cold pill. Or take the example of Bill, who was prescribed a new pain medication after knee surgery. He didn't realize that the drug could cause drowsiness and confusion, especially when combined with his usual sleep aid. After a few days, Bill became so groggy that he fell in the bathroom and broke his wrist. His family worked with his doctor and pharmacist to review all his medications, and they found a safer pain management plan. Bill now keeps a detailed medication list and always asks about side effects and interactions before starting anything new. These stories highlight a crucial point. Communication is key. Don't be afraid to ask your doctor or pharmacist questions like, "What is this medication for? How and when should I take it? What side effects should I watch for? Are there any foods, drinks, or other drugs I should avoid? What should I do if I miss a dose?" Write down the answers and keep them with your medication list. If you ever feel rushed or overwhelmed at an appointment, bring a trusted friend or family member to help you remember the details. Organization is another powerful tool for medication safety. Use a pill organizer with compartments for each day and time. Refill it once a week and check off each dose as you take it. If you have vision problems, ask your pharmacist for large print labels or color-coded bottles. Some pharmacies even offer blister packs, which separate your pills by day and time, making it almost impossible to mix things up. Set reminders on your phone, watch, or with sticky notes in places you'll see them. If you travel, bring a copy of your medication list and enough pills for your entire trip, plus a few extras in case of delays. Never pack medications in checked luggage. Always keep them with you. Regular reviews are essential. Schedule a medication checkup with your doctor or pharmacist at least once a year, or whenever you start a new drug or have a major health change. Bring all your medications, including over-the-counter products and supplements, in their original containers. Ask if every drug is still needed, if the dose is right, and if there are any new risks or interactions. Don't be afraid to ask about alternatives, especially if you're experiencing side effects or trouble affording your prescriptions. Advocate for yourself. If something doesn't feel right, if you notice new symptoms, confusion, or changes in how you feel, speak up. You know your body best. Sometimes, even a small adjustment can make a big difference in your comfort and safety. Finally, educate your loved ones. Make sure family members or caregivers know what medications you take, where you keep them, and what to do in an emergency. Keep your medication list in an easy-to-find place and update it whenever something changes. In a crisis, this information can save precious time and prevent dangerous mistakes. By taking these practical steps, communicating openly, organizing your medications, reviewing them regularly, and involving your loved ones, you're building a strong safety net around your health. Remember, medication safety isn't just about avoiding mistakes. It's about empowering yourself to live with confidence, independence, and peace of mind. As you move forward, remember that medication safety is not a one-time task. It's an ongoing process that evolves as your health and life circumstances change. The more proactive and engaged you are, the more you can reduce your risks and enjoy the benefits your medications are meant to provide. Let's wrap up with a few more expert-backed strategies and a powerful reminder of why your vigilance matters. First, make it a habit to update your medication list every time something changes. This includes new prescriptions, changes in dosage, or stopping a medication. If you're hospitalized or see a new specialist, bring your list and review it with your care team. This simple step can prevent dangerous duplications or omissions, especially during transitions of care. Next, be aware of look-alike, sound-alike medications. Some drugs have names or packaging that are very similar, which can lead to confusion and accidental mix-ups. Always double-check the name, dose, and instructions on every bottle before taking your pills. If something looks different than usual, ask your pharmacist to confirm it's correct before you take it. Don't forget about refills and expiration dates. Running out of a critical medication can be dangerous, especially for conditions like heart disease, diabetes, or high blood pressure. Set reminders to order refills a week before you run out, and check expiration dates regularly. Expired medications may not work as intended and, in some cases, can even be harmful. If you find old or unused medications, dispose of them safely at a pharmacy take-back program or as directed by your pharmacist. Stay alert for recalls and safety alerts. Occasionally, medications are recalled due to contamination, incorrect labeling, or other safety concerns. Sign up for alerts from your pharmacy or the FDA and check in with your pharmacist if you hear about a recall in the news. If you're ever unsure, don't hesitate to ask for guidance. Be honest with your healthcare team about everything you take, including vitamins, herbal supplements, and over-the-counter remedies. Many people don't realize that natural products can interact with prescription drugs or cause side effects on their own. Your doctor and pharmacist need the full picture to keep you safe. If you have trouble affording your medications, don't skip doses or cut pills in half without talking to your doctor. There may be generic alternatives, manufacturer discounts, or assistance programs that can help. Your pharmacist can often help you find the most cost-effective options. Stay informed. The world of medicine is always changing, with new drugs, new research, and new recommendations emerging all the time. Make it a habit to ask questions, read trusted sources, and stay curious about your health. The more you know, the more empowered you'll be to make the best choices for yourself.